My name is Boris Kovalenko. I'm an orthopedic surgery resident at the University of Washington, and we're going to be demonstrating the application of a ThumbSpicaSplint. ThumbSpicaSplints are indicated for a number of pathologies localized to the thumb, from soft tissue such as de Quervain's tenovaginitis or gamekeeper's thumb, to bony pathologies such as fractures of the thumb metacarpal or scaphoid. We're going to begin by outlining the materials that we use for application of the splint. We begin with cotton web roll, which is used to apply over the bony prominences and to provide padding, as well as to prevent from heat injury. We use plaster of Paris to hold our reduction. Then we use bias to wrap over this, and lastly we use tape to hold everything together. So we will begin by applying our web roll. We start at the level of the wrist, taking care to avoid any creases within the web roll. And then we come up to involve the thumb. It's useful at times to partially tear the web roll, so that way you can contour it appropriately and avoid any wrinkles. And our goal is to have 4 layers thick at the distal and proximal most aspects of our splint. With the patient appropriately positioned and everything well padded, next we focus on the reduction maneuver, which is going to be palmar abduction of the thumb. As opposed to radial abduction, we want to do palmar abduction. And then there are a number of techniques that you can use for applying the plaster of Paris splint. Firstly, we'll show the W configuration. So when we're tearing the plaster, we tear the distal aspect into 3 separate limbs, which splay apart to form a W. We can place this over the patient to determine the appropriate length to ensure that no plaster comes in contact with the skin after application. We then dip it into warm water, taking care to ensure that we're not using water that's too warm, as this can lead to thermal injury to the skin. And then this is applied using the 3 limbs to come around, taking care to ensure palmar abduction of the thumb. Before wrapping this over, you want to make sure that there's no plaster that's in contact with the skin. And once you're satisfied with that, we then apply a courtesy wrap, which will facilitate removal of the overall splint. But we take care to make sure that we leave some portions of the plaster exposed. This will help adhere the bias towards the splint. Then, with similar technique, we apply the bias starting at the wrist, coming up distally towards the thumb, wrapping around it. Here, the bias can be pinched if needed, it can be flipped over, or if it's small enough, it can simply be wrapped around. Additionally, we can use shears so that it can be wrapped appropriately. Once we've applied the bias and taped it appropriately, we then ensure that we're holding the proper reduction, ensuring that we have palmar abduction of the thumb until the plaster sets. If you have quick set plaster, that may be as quick as 4 to 6 minutes. Regular plaster may take a little bit longer. So here we can see that the thumb is in palmar abduction and is extended. Take pride in your work.